The first thing is that traditionally we've used the age of 35 as what we would call advanced maternal age or high risk for a pregnancy. That being said, women who can have healthy pregnancies to 40, over 40, and it's important that we talk with them about what those potential risks are, but it doesn't mean that you can't have a healthy pregnancy.
Okay, and what about the second part of that question, tips looking to conceive?
So I think the first thing is to make sure that as we get older, we do develop some more medical problems. So if you have any medical conditions or you haven't seen your doctor recently, it's a really good idea to touch base with your primary care doctor, make sure that you're in good health and that anything that can be adjusted or treated is treated before you get pregnant. The other thing too to consider is that women who are 40 or over may have a harder time getting pregnant. So before you spend a long time doing it, consider talking to your OBGYN or a reproductive endocrinologist about what your options are so that you can maximize the health of a pregnancy.